Welcome to Weighing a Nation Down, the alarming impact of the obesity epidemic in the U.S., a 2025 perspective. This video will explore the critical issue of obesity in the United States and why it demands our immediate attention. The obesity epidemic in the U.S. is a public health crisis of monumental proportions. It's not just about weight. It's about the profound impact on individual lives, our healthcare system, and the nation's economic well-being. The alarming impact of obesity extends far beyond aesthetics, contributing to a host of chronic diseases and significantly reducing quality of life for millions of Americans. This issue demands our immediate attention because it's a preventable crisis with far-reaching consequences that affect everyone, directly or indirectly. To truly grasp the urgency, we need to understand the scope of this epidemic as we approach 2025, looking at current statistics and projected trends. Current statistics reveal that obesity rates continue to climb, with projections indicating an even more challenging future if current trends persist. This isn't just a prediction, it's a reality we're already facing. Certain demographic groups are disproportionately affected by the epidemic, highlighting the need for targeted interventions and equitable access to resources. The health consequences of obesity are severe and wide-ranging, impacting nearly every system in the body. Common health problems linked to obesity include type 2 diabetes, heart disease, stroke, certain types of cancer, joint problems, and sleep apnea, among others. These conditions significantly impair daily life and can lead to premature death. The burden on the healthcare system is immense, with obesity-related conditions leading to increased hospitalizations, doctor visits, and the need for complex medical treatments, straining resources and personnel. Beyond health, the obesity epidemic carries a substantial economic impact, affecting national productivity and healthcare spending. Direct healthcare costs associated with obesity are staggering, encompassing expenses for medical care, prescriptions, and surgical interventions, diverting significant funds from other essential services. Indirect costs, such as lost productivity due to absenteeism and presenteeism, reduced work capacity, and premature mortality, further compound the economic burden, impacting businesses and the broader economy. Understanding the societal factors contributing to the obesity crisis is crucial for developing effective prevention and intervention strategies. Modern lifestyle changes, characterized by sedentary habits and dietary patterns dominated by processed foods high in sugar and unhealthy fats, are significant drivers of the problem. The role of environment and accessibility to healthy options cannot be overstated. Food deserts, lack of safe spaces for physical activity, and aggressive marketing of unhealthy foods exacerbate the issue, particularly in vulnerable communities. Addressing the obesity epidemic requires a multifaceted approach, encompassing public health initiatives, policy recommendations, and individual actions. Public health initiatives and policy recommendations should focus on promoting healthy eating habits and physical activity from an early age, improving access to nutritious food, and creating environments that support healthier lifestyles. Individual actions for prevention and management include making conscious food choices, engaging in regular physical activity, prioritizing sleep, and seeking support from healthcare professionals when needed. In conclusion, the obesity epidemic in the U.S. is a complex and urgent challenge that demands our immediate attention and collective action. Reaffirming the urgency of addressing this epidemic means recognizing that every individual's health contributes to the well-being of the nation. It's a shared responsibility that we must embrace. Let's commit to a healthier future by making informed choices, advocating for supportive policies, and fostering a culture of well-being for all. Together, we can turn the tide against this epidemic.